Hello,
Hello,
how are you?
I'm fine.
So now I'm going to take examine of complete motor testing.
Okay.
Observe the patient's body position during movement and at rest. Watch for involuntary movements such as tremors, takes, chorea, or fasciculations. Inspect the size and counters of muscles. Do the muscles look flat or concave, suggesting loss of muscles bulk from atrophy or wasting? When inspecting for atrophy, pay particular attention to the hands, shoulder. Inspect for fasciculations in atrophic muscle. If absent, tap on the muscles with a reflex hammer which stimulates them. Best assessed by feeling the muscles' resistance to passive strength. Hold one hand with your hand while supporting the elbow. Flex and extend the patient's finger, wrist, and elbow, and put the shoulder through a moderate range of motion. To assess muscle tone in the legs, support the patient's thigh with one hand, grabs the foot with the other, and flex, fit, and extend the patient's knee and ankle on each side. Note the resistance to moving limb. The muscle strength by asking the patient to actively resist your movement. The patient's dominant side is usually slightly stronger than the not dominant side. Through differences can be hard to detect. Keep the difference in mind as you compare sides. The elbow by having the patient pull and push against your hand. Chest extension at the wrist by asking the patient to make a fist and resist as you press down. Test the grip. Ask the patient to squeeze two of your fingers as hard as possible and not let them go. Test both grips instruments to help compare the right hand grip with the left. Test finger abduction. Position the patient's hand with palm down and fingers spread. Instruct the patient to prevent you from moving any fingers as you try to force them together. Test the position of the thumb. Ask the patient to touch the up of the little finger with the thumb against your resistance. Test flexion at the hip by placing your hand on the patient's mid-thigh and asking the patient to raise the leg against your hand. Test adduction at the hips. Place your hands firmly on the bed between the patient's knees. Ask the patient to bring both legs together. Test abduction at the hips. Place your hands firmly outside the patient's knee. Ask the patient to spread both legs against your hands. Test extension at the hips. Have the patient push the mid posterior thigh down against your hand. Chest extension at the knee. Support the knee in flexion and ask the patient to straighten the leg against your hand. The quadriceps is the strongest muscle in the body, so accept a forceful response. Chest flexion at the knee as so below. Position patient leg so that the knee is flexed with the foot resulting on the bed. Tell patient to keep the foot down as you try to straighten the leg. Test for dorsiflexion and plantar at the ankle by asking the patient to pull up and push down against your hand.